Hello everyone, it's Sammy, and of course it's been a long time since I've done an update. So um, here I am. We are still in Atlanta, Georgia. Sam is still at the Shepherd Center, um, and he's still progressing in therapy. It's hard to explain um, what it's like because it's difficult, they say around here, if you've seen one brain injury, you've seen one brain injury. Every brain injury is different for each person. So someone could be exactly the same from everything. The cause, the time, the type of brain injury, all of that, same age, same sex, same whatever, and present in totally different manners. So um, I figured I would maybe talk. I don't think I've ever really talked about how or like you know um, what his injury is like, or like what anything like that. So it's an anoxic injury, brain injury. It was caused from a lack of oxygen from when his blood pressure dropped just low enough for just long enough to cause the brain not to get enough oxygen for a period of time. So anoxic brain injuries are, you see them a lot with like people who had like almost drowned, electrocution. They are the more rare type of brain injury, and one of the, I mean, they're, well, not one of the, they're the they have the longer and harder road to recovery. Every road is hard and long, but kind of how they describe it here is with like traumatic brain injuries, then and even like with stroke and aneurysm, which stroke and aneurysms, they are more similar to anoxic. They're kind of in that same, they're called acquired brain injuries instead of traumatic brain injuries, because something didn't like hit them in the head, something happened in there. So again, and then probably there was loss of oxygen and stuff to the brain at that point too. So there's some anoxic properties, but with them, then it's mainly one section of the brain that has been damaged, that had, well, been injured, I should say, not really damaged, but injured. So that one, like with traumatic brain injuries, then one area gets hit, kind of the brain can kind of bounce around in the skull, so maybe there's like some bruising on both sides, things like that, but the damage is where the trauma happened, traumatic brain injury. So if you get hit really hard on where speech comes from, then that's where that's what is going to be affected. And the rest is kind of okay. There's all sorts of other things that go into traumatic brain injuries and stuff. There's I forget the exact word for it, but it's pretty much like where pieces of the brain kind of, they just shift a little bit, and it's not like tear, but they just like gink. And axle diffusion or something like that. I know I have that one wrong. I've heard about it in a lot of like the support groups and stuff like that I go to, but it's not something that Sam has, so I'm not as familiar with it, because you tend to just get really knowledgeable about what your patient has. But with that, then it's like things are kind of out of place, and then they kind of, hopefully, and over time, then they, it's normally like they kind of click back into place, and then, there's a big burst of recovery. With traumatic brain injuries, then you'll see big jumps in recovery, then with some plateaus and big jumps, and kind of like that, and then a lot of their intense recovery, that very generally speaking here, happens within like the first 6 months, and then there's still progression. It's just slower, but still kind of like those jumps, plateaus. With an anoxic brain injury, then it's different, because with that, then it's the whole brain has been affected, all of it, all the different areas. Now, the good side of it is, for the most part, again, very generally speaking, is more areas are affected, but not as intensely, versus like with the traumatic brain injury, one area could be affected, incredibly hard, and that's how it goes. So with Sam, his whole brain was affected, all the bits, which is why I tell people a lot that he's literally relearning how to do everything. You kind of, not to like, I don't know, not to belittle it or anything, but just kind of to put it in perspective, a good way for people to kind of understand is like an infant. You have to, you have to teach them how to walk. You have to teach them what the color names are. You have to teach them how to speak. With Sam's injury, then, and with most anoxic injuries, then it's also not just these things that you learn. Like when you're born, you know how to swallow. It's like a reflex. It is something that is like in there. Learning how to use your voice, controlling it. Like you might have to learn how to talk, but they can make, babies cry, right? They get loud, they cry, all that kind of stuff. They laugh with sound, stuff like that. Like it's more, there's a lot of reflexes that babies have, like the suck swallow. They suck, like obviously, that's breastfeeding. They suck on the nipple, like that's a reflex. That is something that is just there. They know how to do it. They don't have to be taught that. With Sam's type of injury, then a lot of those things that are normally just done, even from like an infant standpoint, then he has to relearn how to do, like relearning how to swallow properly and quickly, and when to swallow and things like that, and to swallow with your mouth closed. Things you never think about. Like, I never really knew that I swallow with my mouth closed. I mean, I'm sure if I thought about that, then I would know, but who thinks about that, right? So here's something fun. When you're just like out and about, like, or, well, probably at your home, but when you're eating or drinking or something later on, try to swallow with your mouth open. It's incredibly hard. Like I'm not talking like just lips open, like open your mouth and try to swallow. Like, it's hard. I haven't really been able to do it, Sam does it all the time. We don't like it's really hard to do. He does it all the time. We actually have to like get him to close his mouth, which is one of those things, but so yeah, so you think, a lot of this is like thinking again, like an infant. When a toddler or a child, they don't really have like that next level of thinking of how they affect their environment, the people around them, stuff like that. Like they're like, it's kind of all about them. It's like that, their ego, like not like, oh, ego, but literally like you're the ego, like the id and all that, like the ego part that is all about them. That is what we have, like for self-preservation and all that. And then you learn later how to like interact in society, and that, yeah, when you throw a temper tantrum in the middle of the grocery store, like, you normally don't do that, right? Like you learn that like how to control all that. So those are other things that Sam is like learning how to do, and those will come back, as time goes on. So the road to recovery, like you never know what it's going to look like. There's progress. You take steps back and forward and back. Every day is different. You kind of have to take it every day. So a lot of times people ask me like, how's Sam doing? I kind of give like pretty much the same answer all the time, is the majority of it is positive. We're still struggling with stuff, and that's true. It's not just like a thing that I tell people. It's not a lie. Like that is true. But it's hard because every day is different. Something that he does today, he might not be able to do tomorrow. Something that he does tomorrow, he might not be able to do the day before, or the next day, last week, maybe he was able to do stuff that he's not able to do this week. Like it's all steps around, I like to think, and his therapist like to think, that if he's done things a couple times, then he'll be able to do them again. It's just a matter of getting the coordination and the control to do them consistently, you know. So that's why we think, you know, that he'll be able to talk again, because he's talked. We hear him talk. It's kind of funny, like the thing that I hear his voice on the most consistently recently, you know, being like this week, is him being panicked and telling me, I lost my voice. I'll be able to hear every single word of that, you know? So I'm like, you didn't lose your voice, because I clearly heard every single word of that. It's whispers. It's not like he's talking in normal volume or yelling or anything like that, but I can hear it, and I tell him that's why we know it's not, you haven't lost it. You just have to learn how to control it and to be able to access it and use it on your terms when you want to do it. You know, it's going to be a very long road. I'm sure some of you are aware of this. Some people, I would have never known any of this before, because I have no experience with this, or really any type of serious illness or sickness. Normally, like in my family and stuff, and in my life experience, friends and things like that, when people die, then they die quickly. Like it's not a prolonged thing. It's not. So I don't have a lot of like this medical knowledge that some of you probably do, you know. Brain injury again is tricky, because you don't know, you know. I mean, you never know with a lot of stuff, but there's no way to tell what his recovery is going to look like, how much he will regain, how much he won't, you know. A lot of it's just waiting and seeing, and every day just taking it one day at a time, and keeping working, keep pushing, keep fighting for that control, and going to sleep and doing it all over again the next day, and doing it again and again and again. And repetition is huge, you know. You just have to keep saying, I tell him all the time, I'm like, you can call me Sammy the Broken Record, because we have the things that I just say and I say and I say every day, you know, that I say, and just constantly. And that's just kind of how it is, you know. I posted some videos to the group of him like sitting and standing, you know, sit, stand, doing the stairs, alternating, you know. That was a really great day, you know. He's struggling with the stairs again. That's okay. We're just going to keep repeating it. We're having some new movement issues come up, because there's always something new with Sam, you know. Even here, where every patient is different and everyone's facing these different challenges and everything, even here, like Sam is a unique and challenging case, which is okay, you know. Of course, wish it was smooth sailing and kind of just like, you know, just, I can't say textbook, because there is no textbook for brain injuries or anything, but, you know, you wish that he wasn't a challenge, that it was just smooth sailing and everything. But, you know, it is what it is, and he does continue to make progress. So in my mind, that's all that matters. There's going to be setbacks, there's going to be regression, and, you know, and then there'll be progress after that. So we just have to keep plugging away. We're working on the medication side still. Nights are rough. He was going through a lot of like really sleepless nights and everything, having a lot of like nightmares and night terrors. That section is gone, but now, you know, now it's just like he wants to know where I am at night, you know, because I'm not at the hospital with him. I stay elsewhere. I stay here in a fancy hotel room. Until next week, actually, and then my time here is up, and I will actually be staying in the room with him from then on. We wanted to make sure, in case you're wondering, like, why I wasn't just staying with him when I had that option, is my presence can be similar to, like, a medication, like a drug, you know. He is calmer and more content when I'm around, you know. So if he's having trouble sleeping, then we want to know that we've fixed the problem, the root of the problem, and not just slapped like a Sammy Band-Aid on it, you know. So that's where we are now, on nights and stuff. So he's at least sleeping more in like chunks, you know. He's getting like 5 to 6 hours of sleep a night. He takes naps or at least one nap a day. If there's time between therapy to get more, then we get more. Another thing with brain injury recovery is that with a lot of, when you make progress, like every step forward brings its own challenges, and its own issues, as they become more aware. Sam used to not ask where I was at night because he wasn't as aware of his environment and surroundings. So he's becoming more aware, which is good. We want him to become aware in everything. It's nice. But with that awareness, then he realizes that he's in an unknown environment and that I'm not there. His memory is, short term is not really there. It's kind of weird how all of that works too. It's back, I think I talked in one of the other videos about how, your brain has, it's this amount of brain power, and it's trying to heal and do this, and it's prioritizing like what it wants the power to go to, so it's working on healing and relearning how to do all sorts of stuff, so short-term memory to it right now is not important. It's not, it's not on the list. Now, as time progresses, then that should be something that comes back. There's always the chance that it won't, we don't know. That's one of the things we just have to wait on. But, so you can tell him, why I went into that is like at night, you can tell him that he's at a hospital, he's safe, everything's fine, he'll be fine, he'll calm down, he'll go back to sleep. Next time he wakes up, he will not remember any of that. He won't remember any of the conversations or anything. He normally doesn't remember the therapy sessions themselves. He's at the point where he recognizes all of his therapists. He recognizes their faces. He doesn't know their names yet, but he recognizes their faces. He knows, that means he's going to do something. But the actual sessions of therapy, doesn't remember. When we first came here, then, we were sailing through all of the therapy sessions because, he just kept going and going and going. It was awesome, But again, with that awareness, getting more aware, then in therapy, when he's tired, he doesn't want to keep going, So we tell him, this is why, this is why we're here, this is why we're doing it, and he can rally and continue for I would say 99% of the time. That's like what he does. If it's something that he's really not interested, the other good thing is with more awareness and everything, then he's getting better at communicating. He's, mouthing words better, or, so he can let them know when he's not on board with doing something. At that point, then they can give him some options. That's something that we've realized, you try different techniques of what works with different people. So, you give him a couple options, and then he can pick from those. It also gives him, we want to be able to control what we're doing and have a choice in our life, and even not knowing that or anything, or like putting that together subconsciously, it's still there. Like you want to be able, like he wants to choose something, so normally now, like they give him some options, and okay, he picks one of those options and we're good to go, occasionally then it's a, hang out for a little bit and wait for him to forget that he doesn't want to do it, and then start up again, so there's like also playing to the fact that sometimes he forgets stuff, so you can wait a little bit and see if you can go back to what you need to do, normally the redirection, the giving option works, and we're good to go. So it's all tricky. It's all tricky stuff. It's different. Like every day, like I said, every day is different. You never know what you're gonna get. You can't just assume that it's gonna be like the day before. He doesn't. For a while, he was really good about it. Like he knew that he had a brain injury. That's kind of left. At this point. We go over the same stuff. They say like when they call it orientation here. I say after a brain injury or after something like this happens, then there's like a post-traumatic amnesia phase where they don't really remember. Like they say majority that he's not going to remember this part of his recovery, or maybe just flashes and things, but not really remember it. As he gets oriented to life, then that's when, again, that memory will start kicking back in, and then he'll start remembering more of this stuff like in the future and everything too. But again, who really knows? Gotta wait on that too. But becoming oriented, then the first thing you become oriented to after something like this is yourself. Like he knows who he is. Like he's known that for a while now. Like when they first come out, when they emerge, which is also the fancy words that we use here and everything. Like when you're in the disorders of consciousness, or when you're in a coma or whatever, and you come out of it, you emerge, then sense of self is the first thing that comes back, of who you are. Sam has that. He's had that part for a while, and that is pretty normal to have that for a good bit of time before like the rest of it comes back. The second thing that comes back is place. So like where you are. They ask a lot of the same questions, and I go over a lot of this information with him, 3-4 times a day. Definitely in every meal I go over it with him, and then normally at bedtime too. And we're in Atlanta, Georgia. We're at the Shepherd Center. It's a rehabilitation hospital. He has a brain injury. It's caused by a lack of oxygen. It's called an anoxic brain injury. So besides the brain injury part, the Atlanta, Georgia Shepherd Center Hospital, that's place. That's we're trying to get him oriented to where he is. So we tell him, they ask him a lot. The nurses, his speech therapist, they go over that a lot, Some days he's great with those. You ask him, it's not great in like that he's supplying the answers, but you say, Sam, do you know what city we're in? And he'll shake his head no. If you give him 2 options, are we in Knoxville or are we in Atlanta? He'll mouth, some days he'll mouth Atlanta, if we're in Atlanta, what state are we in? He might not, the majority of the time he's not supplying these answers. Like they always give him the chance to, and then give him some options. Or like with hospital, they give him some hints. There's nurses here. There are people here to get better. There's therapists. Stuff like that. There's doctors. And then so they give him hints or options, and then he goes from there. So some days he nails it. He knows at Atlanta, Georgia, he knows Shepherd Center, he knows it's a hospital, he knows he has a brain injury. Some days he gets all of those right with the options. Sometimes he might even supply some of those. Shepherd Center, hospital, he supplies those, of supplying them. He does that most frequently. But then other days, he won't get any of them. He won't get any of, he might get 1 or 2, So again, it changes, like, until it's consistent. That's why we constantly are going over it, constantly, that's like, it's the scale of how that is changing, that he's becoming oriented. So after place is time. Time is tricky, because it's tricky even when you don't have a brain injury. Time slips away from you. You go into a movie and it's like you're watching a movie for like 30 minutes, but then it's like 2.5 hours and you're like, oh crap, or you take a nap. And I mean, we've all done that, where we've taken a nap and then woken up and it's like, I don't know, you look at the clock and it's like, oh, it's 4 o'clock, and you're like, crap, I was supposed to be at work at 4 o'clock, but it's really like 4 o'clock in the morning or something. Like it's, you're just like off. You've had those little like weird things. Time is hard. And, but same thing, we ask him a lot, month, date, a year, and that's hard too, because, I mean, in general, sometimes I don't know the date, I mean, I do now while I'm here, because I'm telling him frequently throughout the day, but, in general, in life, like, you ask me what the date is, like, sometimes I gotta look at a calendar, we don't automatically know that. So that's why time is always last, because it's just tricky. It's a hard thing to a hard concept to grasp. So until he's fully oriented, then we really don't have, I mean, there's there's things that we can see, but, like that's when when that happens, then we'll be able to see a lot more. Like, that will be a big step of being able to start seeing where his road to recovery is leading, you know. With an anoxic, I think I talked about like the traumatic, it's normally jumps, plateaus. With anoxic, it's not. Traumatic, you'll see a lot of progress in those first 6 months, and then like slow increase or like slow jumps and plateaus, you know. With anoxic, it's different. It's a longer period, again, because so many, like the whole brain has been affected. And it's normally just slow and steady. It's not these big jumps and plateaus. You know, it's just slow and steady, which is what we're seeing from Sam. So a lot of people, you know, I was asking about this because a lot of the patients are traumatic brain injury patients or stroke. Anoxic is rare of all of them. And even here, then there's not a lot of patients that have it. So like in group and in these things, and a lot of the stuff that we talk about is, you know, they talk about it in general terms and everything. So I was thinking, you know, oh my gosh, like, you know, we still have like 2 months, I think. Yeah. Wait, July to August, September, October, November. Yeah. So we still have like 2 more in month 4, you know, we still have 2 months before the 6 month period, you know, but I was starting to freak out because I was like, he's still not really getting that orientation, you know, we're nearing that 6 month mark, you know. So of course it's something that I started thinking about. So I talked to his doctor about it, and I said, hey, you know, this is something I've been thinking about, like what, I don't know, like how concerned should I be, or like what does this mean looking into the future, because it's always hard to talk about that stuff because, again, nobody knows, you know, nobody knows how it's going to be. So, but she was like, well, those, you know, when you hear about the 6 months and stuff, like a lot of that is for the traumatic. She said anoxic, you know, you're looking at like 2 years, you know. Now she's not saying it's going to take 2 years for him to become oriented. It might, you know, you never know. Again, you never know, but she's like, it's not it's as huge of a milestone for anoxic versus like traumatic. You know, she was like, traumatic, you know, we hit the 6 month mark, then, you know, we start thinking differently, that maybe this is something that's not going to come back, or something like that. We start planning different things. She's like, it's not the same with anoxic, because it's just 2 different types of brain injury. So that at least like made me feel good, you know. Or maybe not good, like less worried, I guess. I don't know. This is going to be a long one. I'm already 28 minutes into this. Oh, sorry, y'all. Oh, this is what happens when you don't do frequent video updates, right? Sorry. Lame. I'm going to try. It's just hard. It's hard because sometimes I just don't want to do it, like, to be honest. You know, I get tired of talking about it. You know, don't judge or anything. Sometimes I just don't want to talk about it anymore, you know. Other times, you know, I planned on doing this one Tuesday. That was a late night. Wednesday, I found out that Bowie had died, so I definitely didn't want to do it Wednesday night. And then Thursday, this was actually a late night too, but I was like, screw it, I need to do one. But anyway, so yeah, so that's all of this is to say, this is why it's difficult to really describe how Sam is progressing, because every day is different. And you never know what you're going to get. It's hard, of course. It's much harder for him, you know, than it is for me. Around here, sometimes they're like, is it because they don't remember, you know? But it is, you know, it's frustrating, you know, the becoming more aware, and, you know, you start to realize, you know, that you have deficiencies. Like, you know, he's worried about his voice, you know, about talking. I would be too, you know. That's hard. It's frustrating. It's frustrating not being able to easily communicate with us what's going on with him or with yourself. You know, like it's just hard. It's very hard. he doesn't, the other part is that he doesn't remember the progress he's made, because he doesn't remember, he doesn't remember anything that has happened before, you know. I mean, not anything that's happened before, but he doesn't remember how he was when he got to the Shepherd Center, so he doesn't know that he's made progress. So then these therapy sessions happen, and he doesn't understand why, because all he can remember is this session. So why isn't he making any gains? Because in his mind, he's not, you know. So I work with that too. I've been taking a lot of videos. I haven't posted all of them or anything, but, you know, I show him stuff from back when we were at Carolina Pines. I show him stuff from back when we first got here and progress. I tell him all the time about things that, you know, and I've started, because it is something that he has started to be consistently worried about. I have started doing that, you know, 4 to 6 times a day now. Hey, do you think you've made progress since you've come here? No? Okay, well, let me tell you about it, you know. And I tell him too, I'm like, you know, you don't remember this stuff, which is totally normal. And that's why I'm here, is to remember it for you and to tell you, you know. Sometimes, like, I got to throw out the trump card, you know, of do you trust me? You know, like when it's really not sinking in, or he's not wanting to watch the videos or anything like that, then I just have to be like, hey, do you trust me? You know, and luckily every time that I've asked that question, then he has said yes, because, you know, you know, I know he trusts me, but, you know, maybe one day then he's going to say no or something. I'll be like, crap, my card's gone. So he says, you know, he'll shake his head yes, and I'll be like, okay, well, trust me right now in the fact that you're making good progress here. Everyone is happy with you. Everyone is happy with your progress. You work hard in all of your therapy sessions. Your hard work is what has made your progress happen, you know. And then, like, with the things coming back, like, you have to trust me, you know. We don't know, but we can tell him 100% honestly that where he is today is not where he will be forever. Like, that is something that we are all absolutely certain about, and we can tell him with certainty, because we don't want to lie to him, you know. I don't want to tell him, oh, you're going to make a total 100% recovery, and not, even if he's not going to remember it. Like, that's just messed up, you know. And you run the risk of that might be the one thing that he remembers, you know, and then it's a lie. Like, don't let him remember a lie. So just don't lie to people, right? But I'm getting all rambly and everything. But the main thing is just for me to, like, to be able to tell you that it's, when I tell you the same thing over and over again, of that he's still making progress. The majority of it is positive. We're still working on everything else. That's how it's going to be for a long time. We don't know what the recovery is going to look like. We don't know how far we're going to get or anything like that, but we're all hopeful. I think I said in one of the other videos, you know, our discharge date was November 19th, obviously. The 19th is past. We are still here. We have not moved into outpatient or anything. They pushed our discharge date back to December 27th. And that's good. Like, that's, you know, don't want it to seem like it's a bad thing. It's good, because he is continuing to make progress, and they want more time with him, and they think that they can progress him more before they send him to outpatient, you know, so that's good. It's also given us some time to really continue to work on the medication side of it. We did a big trial today. I won't get into the details on that. Normally, with the type of trial we did, it's for a baclofen pump. Baclofen is a medication that helps with muscle spasticity. They use it with brain injury, spinal cord injury, MS, all sorts of things that they use it for. So we did a trial to see if he's a candidate for the pump. Normally, these trials are pretty conclusive. Like, you know, do the trial and you know if it's going to work. But Sam's special and unique, and again, a challenging patient. So we couldn't get a good read on it. His therapists and doctors are going to talk about it and see where we want to go from here. If we want to do another trial, if we want to head in a different direction, we're gonna see. So I'm not going to get too far into that because it might not even be, it might be totally off the table at this point. So we don't know. It wasn't. We saw some improvement on some aspects and not as much as we were expecting or hoping for or anything. So we'll just have to see. We'll have to see how that goes and where we go from there. I said my stay in the hotel is going to be ending shortly, so I'll be moving into the room with Sam. His doctor is okay with that because the waking up and wondering where I am is again, that's kind of normal. The night terrors and nightmares aspect of it was the concern, which is why I didn't move back in immediately when those started happening. And in general, just like to give him, he needs to be able to be independent and go to sleep on his own. If he can't, then we need to figure out why. So they, we don't, of course, know the exact reason, but we found out, like, we worked on it and they stopped altering medication around a little bit, and those are gone now. Like I said, it's just wondering where he's at and where I am. Even with that, there's different techniques that we use. Like, there's a letter from me that has a couple. It's not a long letter. It's like four sentences that they read to him, at night to try to help him calm down. And for the most part, he's getting 5 to 6 hours of sleep at night. It's all together. It's all chunked, it's not up and down and stuff like that. So once he's going to sleep, he's staying asleep. So that's good. That's kind of like what we were hoping for and everything. So, I really gotta tie this up because we're at 37 minutes now. I do want to start doing some, and hopefully I will, no promises, not gonna lie to you, no promises, but I'm gonna start doing hopefully kind of like shorter videos of just kind of, I don't know, little bits, who knows, maybe some things. I get a lot of questions in like my direct messaging and stuff like that, so maybe I'll try to like answer those, the ones that keep coming up, things like that. So we'll see. Maybe I will, maybe I won't, who knows. But thank you everyone who is continuing to follow and care and send us all of the wonderful energy and prayers and all of that and everything. As always, it's totally helping. Sorry. Ooh, Cracker Jacks. We love you guys. We miss you. The folks that I've talked to on the phone, it's been great. Jess, Adrian, Aaron, John, love you guys. You're killing it. And thanks for all the text messages. Kim, Mike, Kelsey, Michael, Kevin, special shout out to you for just constantly sending funny things to Sam. I show them all of them. I don't respond to you ever, but I show him all of the stuff you send and he loves it. So again, he won't remember, and it's nice too because I can pull them up again later and reuse them. So kind of messed up. Whatever. What can you do? I reuse the same jokes too. It's nice. Don't have to come up with new material. But yeah, all of that. I'll come back to that at a different time. Anyway, so I love all of you guys. Apologies for another long freaking video, but y'all are all awesome, and we do miss you and love you. Yeah, happy Thanksgiving coming up, and happy holidays after that. And I will talk to you I can at least say sooner than the length between these last two, so bye. Love you guys.